Hey everyone, welcome back to the deep dive. Today we're going to be looking at something pretty incredible.
Yeah.
We're talking about Transoesophageal Echocardiography, or TE. And we're so thankful to London HeartbeatsZ Academy over in the UK for providing all the awesome educational material that we're going to be using for today's deep dive. Make sure to subscribe to them on Facebook and Instagram, Spotify, and YouTube to get your regular dose of cool medical stuff like this.
It really is amazing what we can see now.
Yeah, so tell me a little bit more about this T thing. What exactly is it?
So basically, it's like having a window right into your beating heart.
Okay.
It's a technique that doctors use to see the heart in incredible detail, almost like holding it in their hands.
But I thought ultrasounds were already doing that.
Well, they are, but this one isn't your typical ultrasound.
Oh?
Instead of the probe being placed on your chest, it's actually guided down your esophagus.
Hold on. Down the throat.
You got it. That's the tube that connects your mouth to your stomach.
Wow, that sounds really uncomfortable.
I know it might sound a little scary at first, but trust me, it's not as bad as it seems.
Okay.
You'll get some numbing medicine and a bite guard to protect your teeth.
Okay, so if it's not on the chest, like a normal ultrasound, why does it have to go down the throat?
Well, think about it. The esophagus is much closer to the heart than the chest wall.
Oh, right, so that makes sense.
So by putting the probe inside the esophagus, we get much clearer images, especially of certain heart structures that are harder to see from the outside.
That makes sense.
Yeah.
So how does this probe create the images of the heart then?
It's all thanks to these tiny but powerful things called piezoelectric crystals.
Piezoelectric crystals.
Yeah, they're kind of like tiny little microphones that can both send and receive sound waves.
Interesting.
These sound waves bounce off the different structures of your heart,
Okay.
and then the probe picks up the echoes,
Oh.
creating the images that we see.
So it's like an internal sonar system.
Exactly.
That's really cool.
And the more crystals in the probe, the better the image quality.
Right. So
Oh.
are there different kinds of probes then?
Yes, absolutely. There are different types of probes depending on what the doctor needs to see.
Okay.
A standard 2D probe is like your classic ultrasound image, but then we have the 3D probes,
Oh, wow.
which are amazing.
3D.
Yeah, those give you a truly three-dimensional view of the heart.
Oh,
It's like stepping into a virtual reality model of your heart.
that's insane.
It is.
So does everyone get a T, or is this something that's only used in special situations?
It's definitely not for everyone. It's usually reserved for specific cases when doctors need a really, really detailed look at the heart.
Okay, so like what kind of situations are we talking about here?
Well, think about diagnosing blood clots or heart valve problems.
Right.
Or even figuring out the cause of a stroke.
Oh, wow.
It's also incredibly useful during heart surgery.
Oh, I bet.
It allows surgeons to actually see the heart in action while they're operating.
That's pretty incredible.
Yeah.
All right, so now let's get into the details. We're diving into excerpts from the Transoesophageal Echocardiography guidelines from the American Society of Echocardiography, as well as a PowerPoint presentation on T. So what's the first thing that jumps out at us from these materials?
Well, before we even get to the procedure itself, the guidelines really emphasize preparation
Oh, okay.
for both the patient and the medical team.
Preparation. So like what kind of preparation are we talking about?
Well, for the patient,
Yeah.
it's crucial to fast for at least 6 hours before the procedure.
6 hours.
Yeah, this helps prevent any nausea or vomiting during the T.
Makes sense.
The doctor will also carefully examine your mouth and throat to make sure there are no potential issues.
Okay.
Things like loose teeth or dentures that might need attention.
Gotcha. So like a pre-flight check.
Exactly.
Make sure everything's good to go.
Precisely. And speaking of pre-flight checks, the medical team also has their own set of preparations.
Okay.
They'll meticulously examine the T probe for any damage, making sure it's functioning correctly and that it's unlocked.
Unlock.
Yeah, there's a safety feature on the probe that prevents it from accidentally advancing during insertion.
Oh, interesting. So it's locked until they're ready.
Exactly. They'll also double check that they have bite guards ready to protect your teeth.
Okay.
They'll make sure there's staff trained in advanced cardiac life support or ACLS available,
Right.
and that they have all the necessary supplies on hand, like oxygen and suction equipment.
So it's like a well-choreographed dance, making sure everything's in place before the music starts.
Exactly.
I like that analogy.
And throughout the procedure, they'll be closely monitoring your vital signs,
Okay.
your blood pressure, heart rate, oxygen levels.
So they're keeping a close eye on everything.
Absolutely.
Okay. So let's actually walk through the procedure itself. What can a patient expect to happen when they go in for a T?
Well, first, you'll be positioned comfortably on your left side,
Okay.
and the echocardiographer will be right there facing you. They'll apply a topical anesthetic to the back of your throat to numb the area.
Okay.
Once that takes effect, the bite block goes in to protect your teeth.
Got it.
And the probe is gently placed at the back of your throat.
All right, so this is the part where it actually goes down the esophagus.
Yes, but they'll ask you to swallow.
Oh, okay.
As they gently guide the probe down, it might feel a little strange.
Right.
But the numbing medication really helps.
And the echocardiographer is a professional. They've done this many times before.
Exactly. They're highly skilled in this procedure.
Okay, so while the probe is making its way down, what are they actually looking for?
They're using the images displayed on a monitor
Okay.
to guide the probe, and they're starting to assess the heart's structure and function.
Okay.
And there's a specific technique involved to get the best views.
Oh, this is where it gets interesting. Tell me about that.
Well, they use different maneuvers to position the probe correctly.
Okay.
For example, sometimes they'll angle the probe forward, which is called anteflexion, to get a good view of certain structures like the left ventricular outflow tract.
So it's like tilting the camera
Exactly.
to get a better shot.
But they have to be careful not to angle it too far forward,
Right.
because that can increase the risk of complications.
I see.
On the other hand, sometimes they'll bend the probe backward,
Okay.
which is called retroflexion.
Okay.
This is helpful for visualizing other structures like the inferior vena cava.
Gotcha. It
Yes.
sounds like a very delicate process.
It is.
All right, so as they're maneuvering this probe around, what are some of the key views that they're looking to capture?
The guidelines emphasize the importance of a systematic approach, capturing a series of specific views that give a comprehensive assessment of the heart.
So it's like creating a map of the heart.
Exactly. And one of the fundamental sets of views are the mid-esophageal views.
Okay, mid-esophageal views.
These give a clear picture of the heart's overall structure and function.
All right, tell me more about those.
Well-
What kind of views are we talking about?
Well, one of the most important ones is the four-chamber view.
Four-chamber view.
Yeah, it's like a panoramic snapshot of the heart.
Oh, wow.
You can see all four chambers simultaneously.
Really?
It's amazing to see how they all work together, pumping blood throughout the body.
That's pretty incredible.
Yeah,
Are there other views that are considered essential in this mid-esophageal set?
absolutely. We also have the two-chamber view,
Okay.
which focuses specifically on the left ventricle and the left atrium.
Got it.
These are key players in pumping that oxygen-rich blood to the body.
Right. And is there another one?
Yes, the long axis view.
Long axis.
It shows the heart from its base to its apex.
It's like slicing the heart like a loaf of bread.
Exactly.
You get that end-to-end perspective.
You got it.
Interesting. And, from what I understand, the mitral valve seems to be a key area of focus during a T exam. Why is that?
The mitral valve is super important. It's like a one-way door
Oh,
between the left atrium and the left ventricle,
okay.
making sure that blood flows in the right direction.
Got it.
By examining the mitral valve closely,
Yeah.
doctors can identify any leaks or blockages that could be affecting blood flow.
So it's like a quality control check for this crucial valve.
Precisely.
So are there specific views that they use to assess the mitral valves?
Oh, absolutely. There are several views that target different aspects of the mitral valve.
Okay.
For example, the mitral valve scallops and commissural views allow doctors to examine the individual leaflets of the valve.
Okay. Leaflets.
Yeah, think of them like flaps
Okay.
that open and close to control blood flow.
Gotcha.
They can see if the leaflets are moving properly and if there's any leakage, which is called mitral regurgitation.
Oh, wow. So it's really like making sure all the doors and windows are functioning correctly.
Exactly.
What other structures are carefully examined during a T exam?
Another important one is the bicaval view.
Bicaval.
Yeah, it
Yeah.
shows both the superior and inferior vena cava as they enter the right atrium.
Okay, so what are those exactly?
Those are major veins that bring deoxygenated blood back to the heart.
So like checking the heart's intake system?
Precisely.
Yeah.
They're looking to see if those veins are functioning properly
Right.
and if there are any clots that could potentially cause problems.
It's amazing how the T can scrutinize every little nook and cranny of the heart.
It really is.
Well, I, for one, cannot wait to dive even deeper into this fascinating world of T. But before we do, we're going to take a quick break to let our listeners catch their breath, and we'll be right back to continue our exploration of transoesophageal echocardiography here on The Deep Dive.
And we're back.
All right, so we were talking about the bicaval view, which is like checking the heart's intake system.
Yeah.
Are there any other key areas they're focusing on during this T journey?
Oh, absolutely. There's another structure called the left atrial appendage, or LAA for short.
LAA.
And that's a small pouch-like structure in the left atrium.
Okay.
And it's often a hiding spot for blood clots,
Oh.
especially in people with atrial fibrillation.
So that's why it's so important to get a good look at it during a T.
Exactly. They'll carefully examine the LAA, using a sweeping motion with the probe to see if there are any clots lurking there.
Wow. It's amazing how T can pinpoint these potential dangers.
It really is a lifesaver.
So besides blood clots, what else are they looking for?
Well, another important thing to look at are the pulmonary veins.
Okay, the pulmonary veins.
Yeah, those are the veins that carry oxygen-rich blood from the lungs back to the heart.
Right.
T allows doctors to assess the flow patterns in these veins, making sure everything's running smoothly.
So it's like checking the pipes to make sure the oxygen is flowing freely.
That's a great way to put it. They can even spot any unusual connections,
Like what?
like when a pulmonary vein drains into the wrong chamber,
Oh, wow.
a condition called anomalous drainage.
So it's like a plumbing problem.
Exactly.
That's fascinating. So we've explored the left side of the heart in detail.
Right.
What about the right side? Are there any structures there that get special attention?
Absolutely. The right atrium and the structures within it also get their time in the spotlight.
Okay, what are they looking for there?
Well, they'll be looking at the tricuspid valve, which controls blood flow between the right atrium and the right ventricle,
Okay.
making sure it's opening and closing properly.
So it's like another quality control check.
Exactly.
This time for the right side of the heart.
Precisely. And they'll also examine the coronary sinus.
The coronary sinus. What's that?
That's a vein that collects deoxygenated blood from the heart muscle itself.
So it's like the heart's own drainage system.
Exactly.
They make sure it's not blocked or anything.
Right.
It's remarkable how this T gives doctors such a comprehensive view of the heart's plumbing system.
It really is.
All right, so what about the aorta? You know, the heart's superhighway.
Oh, of course. The aorta is definitely a crucial structure to evaluate.
And I'm guessing there are multiple views to capture all its twists and turns.
You're absolutely right. They'll use a combination of long-axis and short-axis views to create a detailed map of the aorta,
Okay.
checking for any abnormalities like aneurysms or dissections.
Aneurysms and dissections, what are those?
An aneurysm is a bulge in the aorta.
Oh, okay. And a dissection is a tear in the aortic wall.
Oh, this is serious.
They are. And T allows for early detection, which is key to preventing potentially life-threatening complications.
So it's like spotting a ticking time bomb.
Exactly.
Wow. So we've talked a lot about the mid-esophageal views.
Uh-huh.
Are there any other perspectives that provide unique insights?
Absolutely. As the probe moves down the esophagus, they'll capture views from different levels, each providing a unique angle on the heart.
Okay, I'm ready for a deeper dive.
All right, so as the probe reaches the upper part of the esophagus, they'll turn it slightly
Oh, okay.
to get clear images of the arteries that supply the head and arms.
Okay. Which arteries are we talking about?
Arteries like the left subclavian artery and the left common carotid artery.
So it's like taking a detour to check the traffic flow on these vital arteries.
Precisely.
Interesting. So what happens as the probe goes even deeper?
Well, as it gets closer to the stomach, around 38 to 40 centimeters from the incisors.
Wow, that's pretty deep. It is. But that's where they get a great view of the coronary sinus.
Okay.
Remember, that's the heart's own drainage system.
Right.
This view helps them make sure that the pulmonary veins are draining into the right place,
Right.
which is especially important if someone's had surgery to correct an anomalous drainage.
So it's like a post-op checkup.
Exactly.
Make sure the repairs are holding strong.
Precisely. And they can also use this view to guide the placement of catheters into the coronary sinus for various procedures.
So it's like having a roadmap to navigate this intricate network of veins and arteries.
You got it.
What happens when they reach the stomach? Is the journey over?
Not quite. The adventure continues as they maneuver the probe into the stomach for what are called transgastric views.
Wait, the stomach. So we're going beyond the heart now.
Well, not exactly. The stomach actually provides a unique window into the heart,
Okay.
particularly the left ventricle.
How does that work?
Imagine you're looking up at the underside of a mushroom cap.
Okay.
That's kind of the perspective you get from the stomach. They'll gently bend the probe backward, a maneuver called retroflexion, to get these views.
It sounds like a delicate operation.
It is, but the images they can capture from this position are invaluable.
I bet. So what kind of views are we talking about?
Well, for example, they can get a really clear view of the mitral valve from below,
Okay.
which helps them assess how well it's functioning.
So it's like getting a second opinion from a different angle.
Exactly. What other transgastric views are essential? Well, they'll capture a series of short-axis views at different levels of the left ventricle.
Okay.
It's like slicing the heart like a loaf of bread again, but this time from the bottom up.
Okay.
These views help them assess the movement of the walls of the left ventricle,
Okay.
which is crucial for understanding how well the heart is pumping.
So it's like checking the heart's engine
Exactly.
to make sure it's firing on all cylinders.
Precisely.
And what else can they see?
They can also get a great view of the mitral valve's subvalvular apparatus.
Subvalvular apparatus.
What's that? That includes the chordae tendineae and papillary muscles.
Okay.
These structures help the mitral valve open and close properly.
Gotcha. So it's like inspecting the valve support system.
Exactly. And the transgastric views also allow them to assess blood flow through the mitral valve using color flow mapping.
Oh, wow. Color flow mapping.
Yeah, it's like adding a layer of vibrant colors to the ultrasound image,
Interesting.
highlighting the direction and speed of blood flow.
So it's like watching a river of blood flowing through the heart.
That's a great way to put it.
That's amazing. Are there any other specialized transgastric views they might use?
Yeah, there are a few more tricks up their sleeve. They might capture a deep transgastric long axis view,
Okay.
which gives a great look at the right ventricle and the tricuspid valve.
So it's back to the right side of the heart for a final checkup.
Exactly. This view is particularly helpful after certain heart surgeries
Oh, okay.
to make sure there's no residual obstruction in the right ventricular outflow tract. And they might also capture a deep transgastric short axis view at the level of the aortic valve.
The aortic valve. Remind me what that is again.
That's the valve between the left ventricle and the aorta,
Okay.
controlling the flow of blood out to the body.
Right.
This view is helpful for checking for any narrowing or obstruction in the left ventricular outflow tract.
It's amazing how these different views from mid-esophageal to transgastric work together to create such a comprehensive picture of the heart.
It really is a remarkable technique.
But we've been talking a lot about the visual aspects of T.
Yeah.
Is there anything else they're using to gather information?
Absolutely. Doppler echocardiography is another essential tool in their arsenal.
Doppler, isn't that what they use to track storms and stuff?
It is, but in this case, it's used to measure the speed and direction of blood flow within the heart.
Oh, interesting. So it's like adding a speedometer to the ultrasound image.
Exactly. They can use Doppler to detect and quantify things like valve regurgitation.
Valve regurgitation.
Yeah, that's when blood leaks back through a valve. And valve stenosis,
Stenosis.
which is when a valve is narrowed, restricting blood flow.
It's like listening to the whispers of the heart,
That's a beautiful way to put it.
revealing secrets that the images alone might miss.
It truly adds another dimension to the T exam.
This is all so fascinating.
Yeah.
But I have to ask, are there any limitations to this T? Are there situations where it might not be the best option?
That's a great question. While T is an incredibly powerful tool, it does have its limitations.
Okay. Such
Well, for example, if someone has certain anatomical variations or has had previous chest surgeries,
Okay.
it might be difficult to get clear views of certain areas of the heart.
So there are times when the view might be obstructed.
Right. And it's important to remember that T is just one piece of the puzzle.
Oh.
It's not a standalone diagnostic tool.
Right.
Doctors will use the information from T along with other tests and the patient's medical history.
To get the full picture.
Exactly.
All right. So once the T procedure is finished, what happens next? What kind of monitoring is involved?
Well, after the procedure, you'll be monitored for a period of time just to make sure you're recovering well.
Okay.
You'll need to avoid eating or drinking for at least an hour until the anesthesia wears off completely.
So it's just a precautionary measure.
Exactly.
Yeah.
And the medical staff will be checking your vital signs, looking for any signs of complications.
Okay. What kind of complications should people be aware of?
Most complications are minor and easily manageable.
Like what?
Things like a sore throat or difficulty swallowing.
Okay.
But in rare cases, more serious complications can arise, like a tear in the esophagus or bleeding.
Oh, wow. So it's important to report any unusual or concerning symptoms right away.
Absolutely. The medical team is there to ensure your safety and comfort throughout the recovery process.
It's reassuring to know they've got your back. Now, before we move on, you mentioned 3D TE earlier.
Yeah.
Can you tell me more about this advanced technology?
Oh, of course, 3D TE is like taking a virtual reality tour of the heart.
Oh,
Instead of flat 2D images, you get a three-dimensional view, which is incredibly helpful for visualizing complex structures and understanding how they relate to each other.
that sounds incredible.
Huh?
I can imagine it being incredibly useful for surgeons.
You're absolutely right. It's revolutionized certain heart surgeries. allowing surgeons to see the heart in a whole new light, guiding their every move. And the technology is constantly evolving, becoming even more sophisticated and precise.
It's amazing how technology continues to push the boundaries of what's possible in medicine.
It really is.
So before we dive into the final stretch of our TE exploration, I want to pause and ask you, our listener, what stood out to you so far? What surprised you? What got you thinking? Share your thoughts, and we'll be right back. To wrap things up here on the Deep Dive. Welcome back to the Deep Dive. So we've been talking about transoesophageal echocardiography, which is fascinating.
It really is a game changer.
And we want to thank London HeartbeatsZ Academy again over in the UK for giving us the awesome material we use today.
Absolutely. If you're interested in the heart and want to learn more, make sure to subscribe to their Facebook and Instagram, Spotify, and YouTube pages. They've got lots of great stuff over there.
All right, so before we wrap up, I want to leave you all with something to think about.
Okay.
We've learned about how TE is being used right now.
Right.
Diagnosing heart conditions, helping with procedures, monitoring patients.
Right.
What about the future, though? Where do you think this technology is headed?
That's a great question. I think the potential for T is huge.
Okay.
As technology keeps getting better, we might see smaller, more portable probes. Ones that could be used in more places,
Okay.
not just in hospitals.
Interesting.
Maybe even in a regular doctor's office.
So instead of having to go to the hospital,
Right.
more people could get access to them.
Exactly. Imagine a future where you could just get a quick T scan to catch heart problems early on. Wow, that would be incredible.
That would be amazing.
Yeah.
And then you could get treatment sooner.
Exactly. And maybe even prevent serious issues.
It'd be like a crystal ball for your heart.
Yeah, something like that. And think about the possibilities for personalized medicine.
Okay.
We're learning more and more about how genes and molecules contribute to heart disease.
Uh-huh.
Maybe in the future, we'll be able to use T to tailor treatments to each patient,
Oh, wow.
get them the best results.
So it'd be even more effective and have fewer side effects.
Exactly.
That's really cool. It's exciting to think that T could play an even bigger role in keeping our hearts healthy.
Definitely. I can't wait to see what the future holds for this technology.
Me neither. Well, it's been an incredible deep dive into this world of T.
Right.
Hopefully you all found it as interesting as we have.
Yeah,
And remember, the more you know about your health, the better you can take care of yourself.
absolutely.
So thanks for joining us on the deep dive.
And keep those heartbeats strong. See you next time!